Hi, welcome back. Today our topic is going to cover saggy eyelids. A couple things we'll discuss are prevention, treatment, and overall interventions that you can do for saggy eyelids. Oh, no, no. Oh, no, no. Hey, no, no, baby. Oh, no, no. Oh, no, no. Baby, you pop me, you got me Gucci. You got them boys on the pressure, you like a movie. I'm down to love you forever, ain't gonna lose it. Welcome back. I'm Rikki Rodriguez, nurse practitioner. I'm going to go over some frequently asked questions I get about saggy eyelids. What I'm talking about today is the upper eyelid. So this area where you put your eyeshadow or eyeliner. A lot of people ask, well, what can I do to treat this hooding or heavy eyelid? Well, let's first get into prevention. So first of all, sunscreen. Of course, we want to make sure that we're using a protective barrier against the sun and environmental factors. That's going to help reduce the amount of damage that happens to this very delicate skin around our eyes. You might not know, but the skin of the face is actually pretty robust or has a thicker layer. But the eyelids and above and below are some of the thinnest skin on our entire body, and we're always exposed to the sun. So finding an eye cream or lotion sunscreen that's going to protect you from those everyday sun exposures are going to be, first of all, the best thing you can do. These kind of preventative treatments and corrective treatments with active ingredients can be found in my description below. What you're looking for in an eye cream is something with retinol and something with niacinamide. Those are active ingredients that are going to help thicken up the dermis and thicken up the integrity of the skin. The thinner the skin, the more crepey or tissue papery it's going to look. Caffeine is also a great active ingredient in an eye cream because it helps tighten up the skin for a temporary amount of time, just making the appearance of the skin be smoother. So what are some things that you can do in the med spa that can help with lifting up the brow or helping prevent some of that sagginess of the skin above the eye? Well, you can put some tox in here. That's going to help release the orbicularis oculi. This muscle squeezes when you smile or when you're looking to the sun, there's whatever reason you're trying to read a menu, this muscle pulls that skin down. So if we relax this muscle, it actually drifts the brow up and opens up that eye. There's also alternatives to maybe putting some support around the eye. If you know an experienced injector like myself who's done different areas, you can put filler in the temple. Sometimes there's hollowing of the temple over time and the brow starts to kind of slope in. If you give some outer support to that brow, you can actually make the appearance of the brow having a more elevated appearance. There are also energy devices that can help with the skin treatment around the eyes. So you have to be very careful going to an advanced provider for this as well, because if the energy goes too deep, you can melt some of that fat, that good fat that's underneath the skin. There's different layers and we can get into that in a different conversation, but we want to just address the dermis, the area where collagen and elastin live. So with a microneedling that includes a radio frequency wave, the microneedles go into the skin, the radio frequency is activated, heats up, and then stimulates collagen and elastin growth. If you are in a fairer skin tone, like blonde hair, blue eyes, doesn't tan so easily, what I'd call a Fitzpatrick 1 or 2, maybe a 3, you can even indulge in CO2 laser, which will literally make little microchannels with heat, making thermal injuries. When that skin is evaporated out, the skin closes down and actually shrink wraps around that area. So when I do CO2 for patients, I always go pretty aggressively around the eyes. And that's because even though the skin is thin, it gets such a great tightening effect. It can be a game changer for a lot of people. Some things that you might want to do to help prevent some sagging of the lids is also not going too heavy on the tox if you get your forehead horizontal lines injected. Treating here too much can actually reduce the ability of that frontalis muscle to lift up, and that will cause your brows to maybe feel a little heavy. That's not something that you necessarily have to do with every treatment, or you can go lighter in that area so you can keep up the muscle strength of the frontalis and kind of have that lift in your brows still there. You can combine that also with before mentioned talks around the eye to help open up the orbicularis oculi as well. If the eyes themselves you want a little bit wider, there is a really cool drop called Upneek, and that helps innervate the Mueller muscle. And that muscle is right along the lash line. It actually helps strengthen the muscle contraction, making your eyes appear more open and brightened awake. Lastly, if you do have extensive hooding, which is where we look at the skin above the eyelid and it's folding over itself and kind of draping over the lashes, not too many things are going to be substantial help besides a surgical intervention. And I'll always be honest about that. If there's little things we can do to help with the skin texture, prevention, or we can try the other things before we get into surgery, that's great. But if there is excess, or we call redundant skin, so skin that folds over itself, then it usually has to be removed in something called a blepharoplasty. There's an upper blepharoplasty where they take a sliver of skin from here as well as a little bit of muscle, and then that just rejuvenates the eye. You want to go to a board certified plastic surgeon or an oculofacial plastic surgeon for that, because they are the experts in that very, very delicate anatomy. So in summary, what can we do for those saggy eyelids? Well, first we want to do prevention. So protecting your skin from the sun. The skin is so delicate and fragile. We want to make sure that it always has protection. UV blocking sunglasses and mineral sunscreens are the best. For nighttime, retinol, niacinamide, and caffeine kind of active ingredients are going to help replenish that skin. There's also the talks that can help reduce the muscle movement around the orbicularis oculi, but then taking it easy on the frontalis. There's energy devices like microneedling with RF or CO2, which is so good. I love it if you're a candidate for that. And lastly, surgical intervention. If you have any questions about the information that we covered in this video, leave a comment for me below so we can go farther into the details. Thanks for watching, and if you enjoy the aesthetic educational content, click here and subscribe for more.